Hello and welcome to the San Bernardino County Department of Public Health training on preparing for national accreditation. This training is intended to provide you with a general overview of the accreditation process, as well as an understanding of where the department is currently at in the process. So let's get started. Let's begin by answering a few questions. Please take a moment to think about the program you work for and the services that you provide. Next, think about the Public Health Department's overall performance. Do you think we are doing a poor job? Do you think we are doing an average job? Or do you think we are doing an excellent job? Now that you've answered these questions, my question to you is, how do you know that? How do you know we are doing a poor, average, or excellent job? Performance is very difficult to measure without having a set of standards to measure it against. And that is what accreditation is all about. Public Health Accreditation is the measurement of the health department's performance against a set of nationally recognized standards that focus on accountability, efficiency, effectiveness, performance, and outcomes, which lead to improvements in the overall health of the community. This process is very similar to what hospitals and schools experience when they go through their accreditation process. Let's think about these examples. When you visit a hospital, you expect to receive a certain level of care. And when you send your child to school, you expect that they will receive a certain level of education. Well, when our clients visit the Public Health Department, they should expect a certain level of service. And by becoming an accredited health department, we can assure them that they are receiving the very best of service. So why is the department currently seeking accreditation? There are many benefits of becoming an accredited health department, not only to the department, but to the programs, our staff, and the community we serve. Accreditation will result in the department receiving national recognition for our public health practice. The accreditation process helps build our credibility and improve both internal and external relationships. Accreditation enhances our accountability and transparency. By going through the accreditation process, we are able to identify areas of strength and areas we need to improve. Another benefit of becoming an accredited health department is that we will have increased access to resources. You may ask yourself, how does accreditation impact me? Well, here's an example. Let's say you work for a program that is grant funded. Chances are you compete for funding with other agencies, for example, San Diego, Orange County, and/or Riverside counties. Well, if those counties achieve public health accreditation and San Bernardino County does not, and we compete for the same funding, who do you think is going to receive the award? That's right, the accredited health department. Therefore, it's in the best interest of our health department, our programs, our staff, and our clients to remain competitive and become an accredited health department. The benefits of becoming an accredited health department don't stop there. Some additional benefits include being able to prioritize and address the long-standing concerns of the department. For example, the department has already begun to identify gaps in service delivery that must be met in order to become an accredited health department. Some examples include incorporating continuous quality improvement and performance management into our daily practice, developing a workforce development plan, and creating and/or updating outdated policies and procedures. Another benefit of accreditation is that the process is designed to break down program barriers. We have already begun to see this happen. All of the department's programs have been coming together to learn about the various accreditation requirements and have been asked to share how they can contribute to meeting these expectations. This has been an educational opportunity for the programs to learn about one another and explore opportunities for collaboration to increase the effectiveness of our services. The process is also designed to improve our management processes, ultimately leading to improved efficiency. Accreditation also documents our department's capacity to deliver the 3 core functions and 10 essential services of public health. The 3 core functions of public health include assessment, policy development, and assurance. The 10 essential services of public health include, number 1, monitor the health status to identify and solve community health problems. Number 2, diagnose and investigate health problems and health hazards in the community. Number 3, inform, educate, and empower people about health issues. Number 4, mobilize community partnerships and action to identify and solve health problems. Number 5, develop policies and plans that support individual and community health efforts. Number 6, enforce laws and regulations that protect health and ensure safety. Number 7, link people to needed personal health services and assure the provision of health care when otherwise unavailable. Number 8, assure competent public and personal health care workforce. Number 9, evaluate effectiveness, accessibility, and quality of personal and population-based health services. And number 10, research for new insights and innovative solutions to health problems. These items can be found in the image to the bottom left of your screen, which is known as the Public Health Wheel. Every public health employee should be familiar with these functions and services because no matter what program you work for in the Public Health Department, these are the functions and services that we provide. Now for the most important question: who is going to be involved in the accreditation process? The answer is everyone. We need all hands on deck. Despite what you may have heard, accreditation is not some top secret project. On the contrary, the more people who know about accreditation, the better. We encourage you to share the information you are learning about today with others. The Public Health Accreditation Board, also known as FAB, is the nonprofit agency that oversees the national accreditation process. The goal of accreditation is to improve and protect the health of every community by advancing the quality and performance of public health departments. Accreditation is not just taking place at the local level. Accreditation is also occurring at the state, tribal, and territorial levels. FAB is also currently in the process of expanding accreditation to other agencies such as military bases and correctional facilities. The main component of the accreditation process is an agency self-assessment, which is based on a set of national standards. These standards demonstrate the capacity of the Public Health Department to deliver the 3 core functions and 10 essential services of public health that were previously discussed. The standards are grouped into 12 domains, which as you can see are taken directly from the Public Health Wheel. Domain 1 focuses on the ongoing assessment of the health of the population in the jurisdiction served by the Health Department and includes the systematic monitoring of health status, collection, analysis, and dissemination of data, use of data to inform public health policies, processes, and interventions, and participation in a collaborative process for the development of a shared, comprehensive health assessment of the community, its health challenges, and its resources. Domain 2 focuses on the investigation of suspected or identified health problems or environmental public health hazards. Included are epidemiologic identification of emerging health problems, monitoring of disease, availability of public health laboratories, containment and mitigation of outbreaks, coordinated response to emergency situations, and communication. Domain 3 focuses on informing and educating the public about public health issues. This domain assesses the health department's processes for continuing two-way communication with the public as standard operating procedure. Domain 4 focuses on community engagement. This domain addresses health departments' establishment and maintenance of community partnerships and collaboration that will facilitate public health goals being accomplished, promote community resilience, and advance the improvement of the public's health. Domain 5 focuses on the development of public health policies and plans. Written policies and plans serve as tools to guide the health department's work and bring structure and organization to the department. Policies and plans help to orient and train staff, inform the public and partners, and serve as a key component of developing consistency in operations and noting areas for improvement. Domain 6 focuses on the role of public health departments in the enforcement of public health-related regulations, executive orders, statutes, and other types of public health laws. Public health laws are key tools for health departments as they work to promote and protect the health of the populations they serve. Domain 7 focuses on the population's access to needed healthcare services. An important role of public health is the assessment of the population's access to healthcare services and the capacity of the healthcare system to meet the healthcare needs of the population. Domain 8 focuses on the need for health departments to strategically approach the development of a competent workforce to perform public health duties. Effective public health practice requires a well-prepared workforce. A strategic workforce includes the alignment of workforce development with the health department's overall mission and goals and the development of strategies for acquiring, developing, and retaining our staff. Domain 9 focuses on the use and integration of performance management and quality improvement practices and processes for the continuous improvement of the Public Health Department's practices, programs, and interventions. Domain 10 focuses on the role that health departments play in building and advancing the science of public health. Health departments should apply innovation and creativity in providing public health services appropriate for the populations they service. Domain 11 focuses on the health department's management and administration capacity. Health departments must have a well-managed human resources system, be competent in general financial management, have data management capacity and capability, and be knowledgeable about public health authorities and mandates. Domain 12 focuses on the health department's support and engagement of its governing entity in maintaining and strengthening the public health infrastructure for the jurisdiction served. Before the health department can even apply for accreditation, there are 3 prerequisites that must be in place. The first is a community health assessment, also known as a CHA, which is a process in which a health department assesses the public health needs in the community. The second is a community health improvement plan, also known as a CHIP, which maps out exactly what the health department is going to do as it works with partners to improve the health status of its jurisdiction. This is a long-term plan. The third is a strategic plan, which sets forth the health department's priorities and how it plans to accomplish its goals and objectives. Our department has completed our CHA and just recently our CHIP and strategic plan, which means we are that much closer to being ready to apply for accreditation. To learn more about these documents, please visit the San Bernardino County Community Vital Signs website at www.communityvitalsigns.org. There are 7 steps in the accreditation process. We will discuss each of these steps on the following slides. Step 1 is pre-application. During this time, we are learning about the Public Health Accreditation Board's accreditation requirements. There are approximately 213 requirements that our department will be expected to meet and provide documentation for. We are also asked to conduct an agency self-assessment, which in turn helps us to identify our strengths and weaknesses. FAB also has readiness checklists that help us gauge whether or not we are ready to progress to the next step. Our Public Health Director and Accreditation Coordinator must both complete FAB's online orientation, which they have both done. The final part of this step will be submitting our Statement of Intent to FAB. The Statement of Intent does not bind the Health Department in any way. It simply notifies FAB that we are the San Bernardino County Department of Public Health and we are thinking about applying for Public Health Accreditation. Currently, we are anticipating that our department will be ready to submit our Statement of Intent in June of 2016. Step 2 is application. The department must complete FAB's online application and submit a fee of $47,700. If our application is accepted, we will have 12 months to submit all of our documentation to FAB. Document submission is done electronically through FAB's eFAB system, which our accreditation coordinator will be granted access to in order to upload documents. Therefore, all supporting documentation must be in electronic format. FAB does not accept hard copies of any materials. Step 3 is documentation selection and submission. During this time, the department will be reviewing and selecting the documentation we would like to submit to FAB that supports the 213 requirements. Step 4 is the site visit. The Public Health Accreditation Board will send a team of approximately 3 to 4 site visitors who will visit the San Bernardino County Department of Public Health. The visit generally lasts 2 to 3 days. However, since San Bernardino County is the largest county in the U.S., stretching over 20,000 square miles and serving over 2.1 million residents, the visit could potentially last a day or so longer. The The site visit team will review all of the documentation that we have submitted prior to their scheduled site visit date. They will come prepared with questions about areas that they would like more details or clarification about. The site visit team will want to visit our administration building, our laboratory, and possibly a few other locations, including our emergency preparedness and response site, to meet our staff, look at the work environment, atmosphere, space provisions, record storage, and working conditions. They will also be looking at our county branding. For example, do we have signage on our health department buildings? They will also look to see if we have availability of assistive staff or technology devices to meet the Americans with Disabilities Act requirements. For example, TTY devices for the hearing impaired. They will also look at the cleanliness, safety, accessibility, and security of our facilities and how we use technology to support public health functions. This team will conduct interviews with our program managers, public health director, members of our board of supervisors, partner organizations, our laboratory director, state and tribal representatives, and anyone else that may be asked to join the interviews. This team may want to talk with you. If you happen to be walking in the county parking lot wearing your county ID badge, which we all do, and a site visitor spots you, they may ask you, what is your role in public health, and how do you fit into the accreditation process? So as you can see, the more staff that know about accreditation, the better. The site visitors will be taking notes throughout their visit, and at the end of each interview session, they will take some time to develop their site visit report. By the time their visit is over, they will have developed their final report, which will be sent to FAB's accreditation committee to make a decision. Step 5 is the accreditation decision. FAB's accreditation committee's decision to grant the San Bernardino County Department of Public Health accreditation status will be based solely on the report provided by the FAB site visit team. There are only two options. Our health department will either be accredited or not accredited. Of course, our ultimate goal is to obtain public health accreditation status. However, in the event that we are not accredited, we will have 90 days to develop a corrective action plan that will explain how we propose to correct our deficiencies and obtain accreditation status. Assuming that we will become an accredited health department, step 6 will be to submit annual progress reports to FAB along with an annual fee. So that $47,700 amount that we talked about previously can actually be broken down into annual payments over a 5-year period. The annual progress report that we submit must include discussions of how we plan to maintain our areas of excellence and improve our areas of weaknesses that will be described by the FAB site visit team in their report. Step 7 is reaccreditation. Accreditation status lasts for a period of 5 years. FAB staff will notify our public health director and accreditation coordinator prior to our accreditation status expiring. At that time, we will then submit another statement of intent to FAB, and the accreditation process will start all over again. So as you can see, accreditation is here to stay. It is going to become a part of our everyday work that we aspire to achieve in order to serve our residents, visitors, and community in the best way possible. So where is our Department of Public Health at in the accreditation process? Currently, we are at step 1, pre-application. We are learning about FAB's requirements, we have completed our readiness checklist and online orientations, and we are in the process of conducting our self-assessment. As you learned, conducting an agency self-assessment is the main component of the accreditation process. So how are we doing this? The department has created teams for each of the 12 domains. Each team has a variety of staff members. Each team includes the department's accreditation coordinator who oversees all of the domain teams. In addition, each team will have an accreditation leadership committee member, domain lead, and co-lead, who are there to guide the process and act as the primary point of contact for providing assistance. Each team also has administrative champions who review all of the domain requirements, participate in all trainings, and provide support for all team members. Domain champions are responsible for leading their assigned domain team, reviewing submitted documentation, identifying gaps, ranking and selecting documents for administration's approval, and are ultimately responsible for defending the selected documentation to the FAB site visitors. Program leads are identified by each program and are responsible for uploading all program documentation for the domain team to review. Subject matter experts are also identified by each program and are responsible for selecting and marking up the documentation they wish to submit to their program leads to upload for the domain team to review. What is taking place during this agency self-assessment? A variety of documentation from each program in the department is being collected in order to assess and demonstrate conformity with the nationally recognized standards. We have 213 FAB requirements to meet. This equates to roughly 327 individual pieces of documentation that will be selected to be uploaded to FAB. Although we upload 327 documents, we will be collecting thousands of documents in order to determine which ones best represent San Bernardino County. FAB does not want to see all of the documentation coming from only one or two of our programs. They want to see a variety of documentation that demonstrates the various services that we provide. Additionally, all of the documentation that we submit must show that we provide population-based services. FAB is not interested in reviewing documentation that demonstrates individual-based services. So, for example, FAB will accept and assess documentation from a public health education program that informs the public of the need for dental hygiene. However, FAB will not accept and assess documentation from a dental clinic that provides individual dental services. What types of documents are we being asked to submit? Some of the major plans that FAB will want to review include our Community Health Assessment, Community Health Improvement Plan, Strategic Plan, Workforce Development Plan, Quality Improvement Plan, Emergency Operations, All Hazards and Risk Communication Plans, and our departmental budget. Some examples of other items may include policies and processes such as procedures, manuals, flowcharts, and our department's organizational chart. FAB is also interested in seeing our reporting activities, data, and decisions, so items such as meeting sign-in sheets, agendas, and minutes could be submitted, or work plans and audit results. Other items include materials to show distribution and other activities, which could be done through emails, use of branding logos, educational brochures, flyers, and newsletters. As you can see, the self-assessment process is very comprehensive. There are a variety of steps that must be completed in order to move us along the path towards accreditation. The first item is that our administration meets with the accreditation coordinator to review the entire domain. Immediately following the review, they select who the administrative champions and domain champions will be. These decisions are based on domain content, individual knowledge, and skill set. Once the champions are identified, they are invited to attend training where they learn about their specific domains, their roles and responsibilities, they conduct a practice documentation review, and they receive technical training. Next, all departmental programs are invited to a domain review meeting where they are asked to identify if they have relevant documentation, and if so, who in their respective programs can provide the documents. These staff become the subject matter experts for that domain. The comprehensive list of subject matter experts is then sent to the administrative staff, who then works with their programs to identify 1 to 2 program leads. The program leads and/or subject matter experts are then invited to training to learn about their roles and responsibilities, how to select, mark up, and upload documents, and they are provided with their domain deadlines for document submission. The program leads and/or subject matter experts are given approximately 1 month to collect and upload their documents. The domain champions then have approximately 2 weeks to conduct their review, followed by the administrative champions who have an additional 2 weeks to complete their review. Once the domain champions and administrative champions have conducted their reviews, the documents go to the Accreditation Leadership Committee lead and co-leads to conduct an evaluation. The final step in the self-assessment process is for the accreditation coordinator to compile all 12 of the domain results into a self-assessment matrix. The matrix will be used to show the areas where we have sufficient documentation, where we do not have enough examples of documentation, and where we have gaps with no documentation at all. Identified gaps will be addressed on an ongoing basis. It is anticipated that the self-assessment matrix will be completed by December of 2015. Beginning early next year, we hope to be able to start the actual documentation selection process and begin preparations for submitting our statement of intent to FAB. Please be assured that if you are selected to participate in the accreditation self-assessment process, you will receive training. The entire process is done electronically utilizing the Department of Public Health's Accreditation SharePoint site, which serves as our FAB document library. Please understand that if you are selected, your cooperation and support is very much appreciated. To become an accredited health department that we can all be proud to serve as a member of will take each and every one of us. We cannot do this process alone, but together we will achieve great things for ourselves, our programs, our department, and our community. If you have any questions or would like to learn more about the accreditation process, please visit the Public Health Accreditation Board's website at www.fabboard.org. Thank you, and we look forward to working together to achieve departmental accreditation. Now it's time to test your learning. True or false? Everyone will be involved in the accreditation process. The answer is true. Everyone will be involved in accreditation. Number 2. How many steps are there in the accreditation process? The answer is B. There are 7 steps in the accreditation process. Number 3. Who are the 2 public health staff members that must complete FAB's online orientation training? The answer is the Public Health Director and Accreditation Coordinator. Number 4. True or false? The entire accreditation process is done by hand. The answer is false. The entire process is done electronically. Number 5. What is the main component of the accreditation process? The answer is A. An agency self-assessment is the main component of the accreditation process. Number 6. How many domains are there in accreditation? The answer is D. There are 12 domains in accreditation. Number 7. How long does accreditation status last? The answer is C. Accreditation status lasts for 5 years. Number 8. What is the name of the nonprofit organization that oversees the national accreditation process? The answer is FAB, which stands for the Public Health Accreditation Board. Number 9. What are the 3 prerequisites that must be completed before we ever apply for accreditation? The answer is A. The CHA, Community Health Assessment, CHIP, Community Health Improvement Plan, and strategic plans are all prerequisites for applying for accreditation. Finally, number 10. How much does it cost the department to apply for accreditation? It costs the department $47,700 to apply for accreditation. Please share what you have learned about accreditation with others. Great job today, and we look forward to working together. Thank you.